Great. Welcome. Sorry, I froze up a bit there. Welcome to this month's edition of our environmental speaker series. My name is Ryan O'Donnell. I am the chairperson of the Environmental and Climate Justice Committee of the Chicago Westside Branch of the NAACP. And we have for our speaker this month, Brian from Respiratory Health Association. And I really want to say thank you, first of all, for joining us, Brian. How are you?
Thanks for having me. Really appreciate it.
Of course. Yeah, I'm really excited. I know you have a really great presentation for us today. So let's just jump into it.
All right. Well, just to dive right into it, who am I? Who are we? My name is Brian Urbaszewski. I'm the Director of Environmental Health Programs for Respiratory Health Association. We've been a local public health leader since 1906 on the west side of Chicago, and we're still around today. We address asthma, COPD, chronic obstructive pulmonary disease, lung cancer, tobacco control, and air quality with a comprehensive approach. Our mission is essentially to prevent lung disease, to promote clean air, and to help people live better through education, research, and policy change. So today I'm going to talk a little bit about air pollution and the impact it has on our health, with a definite focus on Chicago and trying to focus on the west side, and then go into some recent public policy advancements in the realm of electric vehicles and what that's going to mean for us. So, unfortunately, this is from the federal government. We had unhealthy for sensitive groups air pollution only a month ago in Chicago. And this is a chronic problem that we have in the Chicago area where the air is officially, not healthy to breathe. But that really begs the question of what is air pollution and how do we define it? So, what is it? Coming up with a working definition, I'm going to give it a shot here and say it's the presence of a substance in the air at a concentration sufficient to interfere with the health, comfort, or safety, or with the full use and enjoyment of an area. And it would seem to cover, pretty much a good definition of air pollution. It really makes sense. But when you define it this way, you think flying rocks, a sandstorm, and maybe other events would also count as air pollution, and all the way up to things like greenhouse gases, which you may not see or be able to smell or touch. It may not affect your health immediately, but have a huge impact on your health in the way they govern weather and climate. So I'm going to go back and start at the beginning, kind of where America figured out that air pollution really was a bad thing and it could be a deadly thing. In Donora, Pennsylvania, which is a town of about 14,000 people in the middle of Pennsylvania, they had a episode in 1948, October of 1948, where a weather system came in and essentially pushed all the air towards the ground. And the problem here was that this town was in a sort of a bowl surrounded by mountains, and there was a zinc smelter at one end that ran on coal. And the problem was when the weather system pushed the air down towards the ground, it essentially put a cap on this bowl that the people lived in. And that picture you see on the left there is a picture of that town around that time at noon. So you can see what a huge impact that air pollution had from that one event. Why this is famous is because 20 people in that town died within a week. 50 people died within a month, and even a decade later, the death rate was much higher than you would expect than a town of that size, all because of that one air pollution episode. So it really seared into the public consciousness that air pollution can be really deadly, and it can be a severe challenge. And there's even a landmark there. That's how famous this is. But it's not the only kind of air pollution we're talking about. In Los Angeles in the late 1950s, people decided that, something wasn't right. Our eyes are watering. We're coughing all the time. People are having difficulty breathing. What's going on? And the confusing thing was that Los Angeles was everything Denora wasn't. It was sunny, it was warm, it was near an ocean. There was no coal burned in Los Angeles, and it had millions of cars and millions of people. It wasn't a small town. So the people couldn't figure out exactly what was going on. So I'm going to go into this a little bit more and explain what was going on here. Air pollution, the way we track air pollution today goes back to the Clean Air Act that was passed in 1970. And the US EPA, under the Clean Air Act, defined 6 main air pollutants. 2 of them are carbon monoxide and lead. And because, though these were big air pollution problems at one time, because of better technology and changes in policy, namely better car engines that had better combustion, we don't have nearly as much carbon monoxide in the air we breathe. And lead, when we took leaded gasoline, took the lead out of gasoline in the mid-1970s, it nearly eliminated the problem. There's other air pollutants like nitrogen dioxide and sulfur dioxide. Both of these are gases. Nitrogen dioxide is made whenever you burn fuels at a high temperature and a high pressure. So in a boiler or in a vehicle engine, you're going to get nitrogen oxide out of a smokestack or a tailpipe. Sulfur dioxide is a gas made from impurities in burning coal and oil. So when there's sulfur in coal or oil, and you burn that fossil fuel, you get sulfur dioxide gas as a output from the chimney. And I'll come back to those a little bit later, why they're important. The big problem pollutants we have in the Midwest, in Chicago, and generally in the country writ large are particulate matter and ozone. And I'm going to focus a little bit on those. Again, EPA calls these criteria air pollutants. And why they have that label is because it regulates them, because it develops human health-based or environmentally based criteria for setting permissible levels. That's shorthand for it creates health standards that it uses as a measuring stick to determine if areas have air that is safe to breathe or not safe.
I know. Sorry to interrupt.
Go ahead.
I know we just talked about, you and I talked about offline, how there is a new initiative in Chicago's Climate Action Plan to get more effective measurements of air around the city. Because you said, do you want to say more about like the lack of that measurement currently?
Sure. Oftentimes it's hard to get an exact measurement on a block by block or even neighborhood by neighborhood system because the air pollution measuring devices that the federal government and the state government use are very expensive and they're far and few in between. So in the city of Chicago, it could be 3-4 miles between air quality monitors. And once you get outside of Chicago, you can get 30, 40, 50 miles between air quality monitors because they're very accurate. And because they're very accurate for government tracking purposes, they're expensive. I mean, you're talking $20,000, $30,000 a piece. And so it's really prohibitive to blanket a urban area with a lot of these devices just because of the cost. They also need to be maintained and tweaked. So you have a lot of labor costs and labor time to be able to make sure that these things work properly. There are smaller, cheaper devices that people are starting to use at neighborhood and community levels to measure air quality. They're not quite as accurate, but they do give people a good sense of what's in the air. And there's even efforts that are going on now looking at satellite data, where their satellites are powerful enough that you can see down to the ground level and how bad the pollution is by how much light is blocked by the air pollution. So there's different creative ways that people are starting to look at, like, how do you get to that neighborhood level? But it's really hard based on the way the federal government does things now because of the fine accuracy and finickiness of the air pollution measurement devices and just the cost of running that.
But it does sound like you are agreeing that there is a need for more accurate air quality measurement standard?
Oh, yes, very much so. It's just the difficulty of solving an engineering problem of getting to that point. And later in the presentation, I'll explain sort of like why, in very short distances can make a big difference in what air pollution people are breathing.
Yeah, we're currently we've been reviewing the Chicago Climate Action Plan draft. And so I saw that they put aside $24 million specifically around that, which is a big chunk of that plan. So yeah, I'm excited to learn more about how that can affect and help us in Chicago in general, but especially the West Side.
Got it. So looking at these health standards that the government has set, the reason is because if your air pollution levels are too high and the government measures that they're too high, then there's a process under the Clean Air Act that goes into motion to basically say you have to add additional pollution controls in your community to clean it up so that you do meet these health standards. So it does act as a trigger if you find bad air pollution levels, that new policies have to go into place to reduce the air pollution people are exposed to. And these air pollution standards that the government sets aren't static forever. They're reevaluated every 5 years based on the most recent science to say, like, did we find anything new? Did we find any new health threats from air pollution that we didn't know about before? Or is air pollution causing health problems at lower concentrations than we saw before? So we need to tighten the standard. And that's really important that there's this periodic review, and that the Clean Air Act says that those standards have to be based on science. And again, 2 air pollution challenges remain in the Chicago area: ozone, a main component of smog, summertime smog, and PM2.5, which is particulate matter less than 2.5 microns. And I'll explain that in a minute. Again, Chicago, huge metro area, 16 counties, almost 10 million people, huge freight rail hub and truck hub for America, lots of traffic, millions of people on the road, huge economy, and our industry base is massive. It's not really surprising that we have an air pollution problem here. We have not met EPA air quality health standards since the 1970s. And even when COVID hit and everything shut down, because of the amount of truck traffic in the Chicago area, average daily soot concentrations were found to be higher than they were prior to the COVID shutdown, because everybody was ordering things on Amazon and there was a huge amount of freight going through the Chicago region.
Why, if we can go back just a sec, why haven't we met those EPA air quality standards, and why haven't we been made to meet them? Like, why hasn't the EPA enforced that for Chicago?
Couple reasons. One, it's really difficult. And 2, we have been making progress. But like I said, every 5 years, they're supposed to reanalyze that standard and see if it's sufficient or not. And what has gone on over the last several decades is that when the EPA does that, and they look at the more recent science, they find like, oh, there are more health problems than we thought that are caused by air pollution, and there's more air pollution damage done at those lower concentrations than we thought before. So they periodically tighten the standard. So we have been making progress towards cleaner air over the last 50 years, but we're also moving the goalpost because we're using the most recent science to determine what is safe. So I don't want to say that we haven't made progress over time. We have. It's just that we're finding out that air pollution is a lot more dangerous than we thought it was originally, and therefore we're continually having to reduce air pollution to keep people healthy. That make sense?
It does. Thank you.
All right. So when we talk about ozone, what is it? Ozone is a summertime air pollutant for the most part, and it's because it's not emitted from tailpipes or factories or anything directly. We're emitting the ingredients. We're emitting nitrogen oxides, so that's that nitrogen dioxide gas I was talking about earlier. And when you mix that with volatile organic compounds, which are essentially fumes that will burn. So if you think of gasoline fumes, if you think of solvent fumes from paint, if you think of any kind of industrial solvent that will light if you put a match to it, those things go up into the air as an ingredient combined with the nitrogen oxides. If you take then heat and sunlight from the sun during the summertime, it runs a chemical reaction in the sky which makes ozone as a byproduct. And so generally ozone is a big problem during the hot summer months. So when the sun is high in the sky and the sunlight's really strong, and it's able to take those ingredients we put up every single day and make a lot more ozone out of them during those days than it does, say, in the wintertime. Fine particulate matter. It includes tiny droplets and solids from vehicle exhaust, power plants, and smoke. If you think of the diesel exhaust, black smoke particles coming out the back end of a bus or a truck, that's a good example of what fine particulate matter is. The important point for fine particulate matter is that what the government measures is particulate matter that is less than 2.5 microns in diameter. So it's those little pink balls on the screen. For comparison, that log up there is a human hair, and there's a couple grains of beach sand that look like giant boulders next to it. You could see how tiny these very small particles are compared to something like a human hair. It would take somewhere like 50 of them to equal the width of a human hair. And again, go ahead.
Sorry, just go back for a sec. It looks like PM 2.5 and PM 10 are both very harmful substances. Well, pollen maybe not so harmful, but I see mold is in there for PM10 too. Is there a comparison between the danger of PM10 versus PM 2.5?
They're kind of related. The government has been measuring particles for a long time. At one point, it measured total suspended particulates. So anything in the air is what it measured. So it could be like, pollen, cat hair, dander, bird feathers, whatever. Anything that was caught was weighed. Later on, the science showed that, it's not the really big stuff that causes health problems. It's the smaller stuff. And then they started measuring PM10. So the blue balls up there, and saying, well, that's the part that's really causing health problems. As time went on, the science further narrowed it down and said, you know what? It's the tiniest particles that are causing the biggest health problems. And that's when the government moved to measuring PM 2.5. And at some point they may change that and narrow it down to PM1 or something, but that's where we are right now. It's, again, the danger is in the smaller particles, and I'll explain why in a minute. Just examples of particulate matter, what you would think of, wildfire smoke, ships, refineries and industry, trucks, trains, anything that runs on fuel is going to be contributing to this problem. So particulate matter is a problem across the Midwest, and some particles are emitted directly, that diesel engine soot, but also things like, soil and dirt, smoke from wildfires out west, coal ash that's coming out the top of chimneys from coal-fired power plants. But there's also particles that are emitted as gases that turn into particles as they travel on the wind. This is where that nitrogen dioxide and sulfur dioxide gas that are produced from burning fossil fuels, they come out as gases, but as they drift on the wind, they turn into these very small particles through connecting with other chemicals in the air. And so that's why, if we have power plants that are far away from, major industrial centers, say like in downstate Indiana or downstate Illinois, the gases that come out of them can turn into particles and then impact places like Chicago far downwind. And again, these gases can travel hundreds of miles because they come out of smokestacks that are often several hundred feet high and are designed to make the pollution go as far away as possible. And in most areas around the country, the secondary fine particulate matter, the particles that are made from these gases that turn into particles and affect people somewhere far downwind, this is a big source around the country and around the Midwest. But against the sort of background haze of fine particles that's everywhere in the Midwest, you also have higher concentrations closer to some major emitters, especially things like traffic and high volume roadways. So this is just a quick map of Pittsburgh, where you can see the black carbon fine particulate matter from engines, from traffic, pops off the map as those red lines. Whereas, background levels, you don't see as much there in more residential areas or rural areas, but the roadway really has a high concentration. And like I said, you can see along the roadway, there's a high concentration and it falls off pretty sharply. But for the people who are exposed or working or going to school or living in close proximity to roadways, this is very important, because you're not only getting the background particulate matter that's everywhere, but you're getting an extra double dose from the traffic that's on top of what everybody else is getting.
Yeah, I was thinking.
So when you look,
on the last slide, I was just thinking, because of course we have a major highway running right through the west side of Chicago, and that drop off is so significant, and that I'm imagining that has a big health impact just in those specific areas too. Not even talking about the whole west side, but very much the ones very close to those highways too. And also, I'm curious to know if with PM10 and PM2.5, if it makes a difference as to the drop off, whether the highway is elevated or if it is lower. Because I know the one that goes through the west side is lower relative to the highway going through like northwest.
You're right. There is a difference. I mean, and again, this can change from day to day. It depends which way the wind's blowing as well. Where that plume from that's being created along a highway is going to go. There is a difference between a highway that's kind of in a canyon versus one that's elevated. If it's elevated, obviously it'll generally blow further away. If it's in a canyon, it tends to stay more concentrated. And it's not only for the people who are living alongside this or working or going to school alongside this, because there's a lot of schools in Chicago that are right along the highways. It's also people who are driving in through this polluted tube of air pollution every single day if they're commuting. You're essentially breathing everything that's gone before you, and it's kind of trapped in that canyon. So a lot of people, even if they don't live close, right on top of the highway, maybe getting a big dose of air pollution every single day because they're having to travel through it. So when you look at the air pollution, what are the health impacts? What does it do? So I didn't really tell you what ozone is. I mean, it's a gas that's made through this process, but what does it do? It's a very unstable gas, and it essentially burns anything it comes in contact with. It oxidizes things. When you breathe it in, it will oxidize, it will burn the insides of your airways and the insides of your lung passageways. This leads to your body creating a lot of swelling to try and repair the damage that's being done. That can tighten those airways, cause less air to go in and out. And so for a lot of people, you feel this difficulty breathing, or you might feel pain or discomfort breathing. And generally you can feel the difference in it being more difficult to breathe because of what the ozone's doing to the inside of your body and the inside of your lungs. The fine particles, one of the problems of why the smallest particles are the most dangerous is because a lot of the larger particles that you might breathe in are actually caught by filtering systems in your body. There's hairs in your nose, there's mucus in your nose and in your throat that is designed to capture a lot of these particles before they get to your lungs. The problems with the very tiny particles, those ones less than 2.5 microns, is they essentially bypass those filtering systems in your body, can make it all the way to the deepest portions of your lungs, and from there they can actually get into your bloodstream as well. And again, just showing you how tiny these particles are compared to human hair. So what are the health effects of ozone and PM2.5, breathing them? Obviously, difficulty breathing. You're going to see an increase in asthma attacks as well. You're going to see an increase in emergency room visits for respiratory reasons. Same thing with hospitalizations. You're going to see an increase in heart attacks. You're going to see an increase in premature deaths. And on top of these very dire health situations, it's going to cause a lot of people to lose days from work and school because they don't feel well, or they had an asthma attack that wasn't severe enough to warrant a hospital visit, but they weren't feeling good, or the parent was worried about the child. So you have these lost wages, lost activity at school. People are taking more medication and facing the expense of that, or going to doctor's office visits because they had an asthma attack. Again, that wasn't severe enough to send them to the hospital, but was severe enough to say, we need to talk to the doctor because you can't breathe right.
I appreciate you saying that, because I'm always talking about how much environmental issues really have such broad effects on people's health, on their economic status and economic mobility. So I think that's a really great point there too.
And to keep that thought in mind as we go through this too, because it has sort of negative reinforcements based on some other things that I'm going to talk about in a little while. Just to go into diesel exposure, diesel fine particulate matter, diesel exhaust, there's also a connection there with lung cancer I wanted to point out. There's a big study that went on for 20 years that looked at miners, 12,000 miners, and they found a strong relationship between the level of exposure to diesel exhaust, basically how close the miners were working to diesel equipment, and the risk of lung cancer death. And it was significant. Death rates were about 3 to 5 times greater for the workers who worked close to those diesel engines compared to those that had the lowest exposure. And even after they weeded out things like cigarette smoking and other risk factors, that still persisted. So there is this as well. I wanted to make sure people knew. There's other effects too. Again, looking within close proximity to major roadways, heavy traffic, the chance of like coronary artery disease, calcification, hardening of the arteries was significantly higher for people who live closer to those major roadways. It was a German study. There's a lot of other studies out there that look at additional risks too, increased numbers of strokes. There's an increased risk of developing type 2 diabetes if you live within close proximity of a roadway. There's even connections to dementia. Many studies have come out over the last, say, 3 to 5 years that show that fine particulate matter is actually causing brain damage, essentially, as well. So we talked about this a little bit, like how big is the impact? And worldwide, it's huge from fine particulate matter. Fossil fuel-driven particulate air pollution cuts global average life expectancy by about 1.8 years per person. That's a huge chunk off of everybody's life for the billions of people around the world. That is heavily skewed towards very polluted countries where there's large concentrations of people in urban environments. China, India, and the cities in those countries are driving this factor. It's much better than the United States, mainly because we have been making continuous progress for 50 years under the Clean Air Act. We're not where we need to be, but it's a lot better than it would have been if we had not started 50 years ago. But just to show you the scale, the World Health Organization set a standard for fine particulate matter, a health standard of 5 micrograms per cubic meter, but 5 is the important number. That measurement in the Chicago area is about 10 or 11. So we're still more than double what the World Health Organization is saying we need to meet, the standard we need to meet. And because of all the science that's coming out, US EPA, again, every 5 years looks at the science and says, do we need to tighten the standard? They're in the middle of that process right now this year. They're almost ready to propose a tighter standard, and they probably will by the end of this year, because again, the science has shown that those fine particles are much more dangerous than we previously knew, and therefore the limit for what people are exposed to needs to be much lower.
You brought up a great point here too, that I think a lot of times we don't think about as environmentalists too much, even though we talk so much about the earth, we tend to think, um, we don't tend to think too much further out than just our localities. And this obviously is one of those impacts that really harms people that are very close to it, but this also has global implications.
Yeah.
I'm sure that those global implications are in the same way that Chicago's West Side is so disadvantaged because of economic disinvestment and because of all of these compound uh, forms of oppression and compound struggles. I know that a lot of areas in Africa are experiencing that tenfold because of poverty and because of a lot of different climate issues. So these
Yeah.
local things really affect, obviously, our local communities, the west side of Chicago, the entire nation, but also like entire other continents.
Yes. And matter of fact, that's what I was going to go into next. I mean, burning fossil fuels for transportation and for industry and for making power is causing a lot of problems. It's causing world temperatures to go up, and it's causing people to have the climate they depend on disrupted. One of the things you would see is like ozone smog, which is not only a problem here in the United States, but around the world. I mean, you have smog in cities all over the place. As you get longer summer seasons and hotter weather, that drives the reaction faster, and it makes more ozone as a result. So interestingly, global warming is actually making some air pollution situations worse by making people more exposed to ozone pollution. And even beyond air pollution, I mean, burning fossil fuels is dangerous because of just the climate implications. Just to take temperature for one example, if you look at what Illinois' climate or what Chicago's climate is going to look like in about 50 years, less than 50 years, 30 years, it's going to essentially, Illinois is going to slide southwest, and our climate is going to look like what northwestern Arkansas looks like today. This is why that's important. Back in 2011, they had a big heat wave in Fort Smith, Arkansas, which is where Chicago will be in 30 years, had a temperature record set of 115 degrees. So you can imagine what the impact of that would be in the Chicago area right now, keeping in mind that in the mid 90s, we had a much less severe heat wave and over 700 people died in Chicago. This isn't just a Chicago problem. This is a worldwide problem. Heat waves are going to cause not only problems throughout and death, increased death and illness throughout the United States, but around the world, especially in a lot of countries that have very little resources to deal with the fallout from global warming.
That's such a great point. And also, we already know that the West Side and a lot of other disadvantaged communities have a lot of heat islands as it is.
That's
So
right.
these are all compounding issues.
Yes. And there are things like, LIHEAP, which a lot of people depend on for heating assistance, doesn't cover air conditioning. But there's questions like, should, vulnerable people also be allowed to, should the government be helping people get air conditioning because of the growing health threat that we're going to be facing? So there's a lot of questions to be asked here. But we have little time. So the relationship between air pollution and lung health, I kind of covered this, I think. I mean, you would think children and babies are more vulnerable. Older adults are more vulnerable. People living with lung or heart diseases like asthma, COPD are going to be more vulnerable. People who work outside in close proximity to polluting sources. So I just want to quickly cover asthma in Illinois. A lot of people have asthma. It's over 800,000 people in the state. We saw over 7,000 hospitalizations in an average year, 64,000 emergency room visits, and a significant number of deaths. This is where it gets kind of surprising and concerning. Black people in Illinois have a higher asthma prevalence rate than whites or Hispanics. They are more likely to have asthma and be diagnosed with asthma. Interestingly, women are more likely to have it than men. And How much money you make is also a risk factor in whether you have and you've been diagnosed with asthma. If you are making less than $15,000 a year, you're almost double the risk of developing asthma compared to someone who makes more than $50,000. So I wanted to, let people know that there are definite class impacts here. There are gender impacts. There are ethnic background impacts that all affect who is most affected by asthma. And
I'm sorry, is there a way to know how much of this is, I don't know, genetic versus how much of this is based on like the environment that people are living in?
It's hard to know because people don't fully understand what causes asthma, and it might have multiple causes. So it's hard to narrow down like what's causing this disparity. We just know it's there, and people are doing a lot of science to try and tease out why. But the fact is that there are a lot more people who are poor and Black who have asthma, and when you look,
who live in areas with a lot of triggers.
Yes, exactly. And that's where I'm going with this. I mean, if you look at the asthma disparities in emergency department visits or emergency room visits, you can see that the rate per 10,000 people is amazingly higher for Black people compared to white people. It's almost 8 times higher. And it's multiple times, I think 4 times higher than Hispanic, people. There's a huge disparity there that is more than the increased number of Black people who have asthma. If it's double, if the asthma rate is double what white is, the emergency room visit rate should be about double. It's not. It's 8 times higher, and that's a huge challenge for Chicago. It's a huge challenge for the people who live on the west side and on the south side, who are facing this huge extra burden that they shouldn't be facing. And just to like go in and sort of zero in on Chicago again, the percentage of adult asthma, it's less than double, but it's close to that. But you still see that Black children are 4 times more likely to go. It's actually almost 5 times more likely to go to the emergency room for asthma compared to white children in Chicago. Hispanic children also have a higher propensity to go to the emergency room than white children in Chicago. And it's especially a problem on the west side. There's one zip code, I think this is North Lawndale, 60623, where there's over 4,500 emergency room visits over a 5-year span just in that one zip code. And if you look at 60651 and 60644, which are also part of Austin and a little east of Austin, they're the second and third worst in the city. So there's a huge problem specifically in this community where far too many people are being forced to go to the emergency room for asthma. And the city has recognized that this is a problem, and they're working it into the way they plan where polluting industries are going to go, which is important. They sort of meshed the air pollution problem, where air pollution is bad, as well as these sort of social and economic factors that sort of layer on top of that to create a map that shows where people are most at risk from or most vulnerable to air pollution. And as you can see, like the west side kind of lights up. So does the southwest side, where there's a huge concentration of rail yards and industry, and going into the south side. You compare that to Lincoln Park, there's a big difference there in the risk that people are facing from air pollution. And just to sort of finish up a little bit with diesel pollution and give you some sense of the scale. This is just one kind of particle pollution. So it's only looking at diesel engines. It's not looking at power plants or industry or anything else. But a firm on the East Coast has gone through an extensive modeling process with EPA to sort of create a model that would tell you, well, how many people are dying, how many people are getting sick from diesel emissions alone. And you can see, 5,000 asthma attacks a year. They modeled this for next year. So this is what we would expect to see next year based on what's riding around in our area and in our state right now. 416 deaths a year, every year. these are significant numbers. And as you might suspect, it's as you zero in the Chicago area, where most of those older trucks and then most of the congested traffic is where you have the highest exposure to things like fine particulate matter from cars and trucks and buses. And again, because minorities tend to be more concentrated in dense, vibrant urban environments like the city of Chicago versus rural areas. Asian Americans, African Americans, and Latinos or Hispanics have a disproportionate exposure to fine particulate matter compared to whites because of where they live, again. So they're living in areas where they are being exposed to much more air pollution from things like diesel traffic. So that's where we switch and we start talking about electric vehicles. And you wanted to know, what's going on with electric vehicles? When are they all going to arrive? And I just wanted to level set and say, like, what is an electric vehicle? Because there's lots of different ways to define it. And I'm going to be simple here and say we're not going to talk about hybrids or anything like that. We're going to talk about electric vehicles that are fully operational on electricity alone. So they only run on electricity. We're talking about having onboard battery storage. So they're not hooked up to like overhead wires or anything. We're talking about autonomous vehicles that have a battery that can run a motor, that can propel a vehicle. And we're talking about no harmful engine emissions, no tailpipe. And when you start to look at the universe of what's out there now, it's pretty surprising. I mean, you have, of course, electric cars. Everybody's heard of Teslas, and there's a lot of other ones that are out there. You're starting to hear about electric pickup trucks, which is big during the Super Bowl, and they're starting to show commercials on TV. But there's electric school buses. There's electric transit buses. There's electric Amazon Prime delivery vans, that are out there. You're starting to see electric semis and box trucks. There are even people making electric airplanes that are starting to do short service. But that boat down there is actually a 100% electric battery-powered car ferry. I think it's in Norway or Sweden. But they're making things that big that run solely on electricity. So just to give people a level set of what's possible out there. What's going to happen with electric cars in the United States? It's going to explode. Back in 2010, 2011, there were 2 or 3 different electric cars you could buy. We're probably approaching 100 right now. And within 2 years, you're going to be, over 130, 135, maybe even more. There's going to be a lot more vehicles out there that are running on electricity, a lot more different model trim models and stuff like that, different sizes. You're going to start to see more SUVs and pickup trucks, as well as small electric cars, wider and wider variety. So what's going to happen or what's going on with electric vehicles? Why are they starting to show up now? Huge part of the cost of an electric vehicle is batteries, and batteries are expensive. But prices for batteries fell about 90% over the last decade or so, and they're still falling. A little over a year and a half ago, Tesla said, you know what, within 3 years, batteries are going to have 50% more capacity. They'll be able to handle 50% more or store 50% more electricity, and they'll be 50% cheaper. And that's the direction this is going: better, faster, cheaper. EVs already cost less to run per mile than a conventional car because they require less maintenance. Consumer Reports magazine actually tracked this, and they said EV owners are saving about half on the cost of maintenance and repairs compared to gasoline-powered vehicle owners. A lot of this has to do with there's just simply fewer parts, and there's simply fewer moving parts to wear out and break. So this trend means that EV sticker prices for vehicles are heading towards a point where they're going to be equal to a gasoline-powered vehicle within a few years. And because you are paying less every month out of pocket for fueling or charging your vehicle, and you're paying less for maintenance, even before we reach sticker price equality, electric vehicles are going to be cheaper to operate for people. And this applies to new and used electric vehicles. this same general pattern of things getting better and cheaper and more affordable are not only going to apply to cars, but everything: trucks, buses, school buses, eventually things like airplanes. And they're also going to affect how polluted areas are that now depend on a lot of these big heavy duty diesel vehicles like trucks that are polluting a lot of communities.
I like that you're making this economic argument here too. Again, that is constantly like, fossil fuel and all these different industries try to always make it out like we can't afford this, or that like we need to, um, or poor people need to use like fossil fuel for some reason when it's really economically more viable, which is why a lot of wealthier people wind up getting EVs too, right? Because it's an investment, it's a sort of an upfront investment, but running that um, electric vehicle winds up saving you. And with all these new programs, it's not just a matter of doing something for the environment, it's also doing something for yourself that is just a smarter decision.
Correct. It's and I'm going to get to some of the policy things that are going on in Illinois that kind of touch on that too. One thing I just wanted to cover quickly though is like people think that electric car chargers are like gas stations, and that's not quite entirely true. Right now there's not a lot of chargers out there, and you would think it's urging people to buy an electric car is trying to get people to buy an electric car or like a gasoline powered car in a world where gas stations are very few, inconveniently located. They can only fuel one vehicle at a time. They're only open for limited hours. They might be behind locked gates part of the day. But EV chargers are not equal to gas stations. Most EV charging is done at home or in businesses overnight. 80 to 90% of the electricity used in electric vehicles now is from charging overnight. And when you talk about electric vehicle charging stations, a lot of that is being built out so that people can travel between long distances between cities. But it's a challenge in a lot of areas for people who don't have their own garage where they can plug in a vehicle, or they don't have their own parking spot with an electric plug. And so you do need public charging devices in areas, especially with dense multifamily housing. And I know there's, big chunks of the West Side are, apartment buildings where people don't have a garage and are parking on the street. And so this is very important to know that. But when you look at the EV stations that are out there now, there's some holes in places like Chicago. There's an absence of public EV chargers on the West Side and on the South, vast sections of the South Side, precisely where you would need for people to be able to charge who would really want to get on the EV to save money over the long term are sort of being handicapped by not being able to charge it in those areas. And so it discourages people. The Climate and Equitable Jobs Act that passed this past fall has a lot of great stuff in it. And I'm not going to go into it, but it's all kinds of clean energy and money saving, long-term investments that are being made, jobs that are going to be created, especially for communities that haven't seen jobs before. There's going to be added outreach to get, equitable distribution of jobs as we spend billions of dollars building a new clean energy economy. But I wanted to talk about one little section of this that has to do with electric transportation. I'm going to ignore everything else. So the governor has said that, and with this legislation passing, we're going to get 1 million electric vehicles on the roads in Illinois by 2030. That's 8 years from now. That's incredibly ambitious, and it's a little frightening. But the bill also says that 40% of the benefits and investments in things like electric vehicles are going to go to equity investment eligible communities and persons. So this is going to be environmental justice communities and communities that are supposedly getting added access to cannabis selling rights. So it is going to be a large chunk of the West Side and the South Side of Chicago. And And I want to go into some of the pieces that are here in the legislation. Most notably, if you want to buy an electric car, there's a $4,000 per vehicle rebate that you can get from the state of Illinois. We managed to get $18.5 million to fund this. So it's not, money will run out eventually, but it's over 6,000 EV rebates that will be available. The Illinois EPA is running this program. It's supposed to be up and running by July 1st. They're supposed to focus rebates on low-income applicants. So they're supposed to get priority. And low income here means for a family of four, under $75,000 a year, which is moderate. I don't know exactly how they're going to prioritize low-income earners for EV rebates, but that's in process right now, and we'll find out at least by July 1st. Interestingly, this rebate applies to both new and used electric vehicles, which is kind of unique. So we're trying to figure out how to, and our goal in getting this in the bill with all the other great stuff was to make sure that you can make EVs affordable to people who were, first starting to think about it, but we're still being discouraged by the high cost of a new EV. So again, new and used, and getting preference for getting that before the money runs out is kind of important here. There's also $70 million that the state is going to be spending to get more electric charging stations out there, publicly available ones that people can use. They're probably not going to get that until early next year, but the state is actually going to be trying to encourage those to be built in those EV desert areas where they're not being, where you won't find them today, and where there are great needs for them, especially if, lower income people are buying EVs, they're going to need access to that public charging infrastructure. Then there's a thing where the utilities are going to be allowed to spend money as well. And for the Chicago area, ComEd is likely going to be able to spend about $55 to $60 million a year going forward. There's a process where they have to go through and submit a plan, and it has to be approved by the state. But we should see something up and running by the beginning of 2023. We don't know what's going to be in ComEd's plan yet, but it could be EV education programs to make people aware of what's going on, and incentives, cheaper EV charging rates for people who are charging at home to encourage them to do that. EV charging and vehicles for public agencies, so getting electric school buses and transit buses on the roads, public EV charging, like those stations I was talking about. Maybe even more targeted low-income EV rebates on top of what the state's already doing. Home charger EV rebates for installing a charger at home. We don't know, but there's a wide menu of things that will start to roll out beginning next year. There's more money out there. Illinois still has money from a court settlement several years ago against Volkswagen, who made a lot of polluting vehicles, got caught. Illinois is still sitting on $80 million. They have proposed to spend that on getting more electric transit buses, electric school buses, and up to 15% for public EV car chargers. And I want to talk about buses here too, because I know a lot of people who don't have cars, and just can't afford a car, don't need a car. And so it's important that everybody in Chicago is getting access to electric vehicles, and that includes things like getting CTA electrified. Matter of fact, that's something I've worked on for a couple of years. CTA just came out with a plan in February as to how they're going to start doing this. They've got about 25 electric vehicles. They're going to start buying more and more in future years, and they plan to have their bus fleet completely electrified by 2040. There's a lot of things that need to be done to electrify all the garages and all the routes, but just want to let people know that this is in motion.
Why has the city... Sorry, I've been waiting for a chance to jump in. Okay. Why has the city been so slow with the electric buses? I don't understand. You said there are only 25 so far. Yes. of the 1,800 approximately.
Yes, but 10 years ago we had 2. So we're making progress, and
progress.
it's gonna grow sort of exponentially. So it starts small, and then 20, and then it's gonna be in the hundreds. So we're gonna get there. It just takes a while to build the infrastructure you need to charge these things. Some of CTA's bus facilities go back to the horse-drawn carriage era. There are bus barns that were at one point in time had horses in them pulling carts down rails down the streets. So putting in, the capacity to charge, 300 buses at one location is a really big deal. That's going to need a lot of engineering and a lot of help from the utility to make happen. So the Chicago Avenue is the first route that's been electrified, and they're continuing to get more and more electric buses on that route. But eventually they're going to start doing some north-south routes and gradually expand out to where they can electrify the entire area. They are prioritizing areas on the west and the south sides. They're using that map of Chicago that shows increased risk in those areas, and they're specifically targeting bus electrification efforts to go there first for that reason.
I appreciate you bringing this up, because I do think that of course, it is very important that these buses be electrified. But for me, it just seems like such low-hanging fruit. Like, it seems like something that should have been done already. and I'm like already moving on. Like, at this point, I want to get us, I guess, more personal and like work electric vehicles, because I feel like the bus stuff, especially with the bill that you're about to bring up, seems like that stuff the city should have handled. Do you think that is the case, or do you think there's going to be rough patches with them transitioning to electric buses? And
there are always rough patches. It just comes with the territory. Kudos to CTA and the mayor for making this commitment, and CTA for actually, following through with trying to figure out how to do it and setting up a plan. It's going to take a long time to do this. I mean, it's going to take, the next 15 years of hard work to make sure that this actually goes into place, and they get the buses and they get all the charging infrastructure that they need. That's where this comes in. And in addition to stuff the city's doing and CTA is doing, and what the state's doing with the CEJA bill, the federal government actually passed a huge funding bill this past fall. And there's a lot of money that's going towards environmentally beneficial programs. There's $7.5 billion that the country is going to be spending to get more EV chargers out there, mostly on the interstate system. But IDOT is going to get $148 million over 5 years to make that happen. There's $2.5 billion for electric school buses, maybe even double that. There's $39 billion in new transit funding, some of which could be used to accelerate these electrification efforts. And then there's just electric grid modernization too, because you're essentially, phasing out gas stations and refineries and phasing in, electric generation from clean renewable power and getting it to the points where you can plug things in, like buses and trucks and cars.
We had a question. We had a question in the chat.
Sure.
About or I don't know if it was a question. Actually, it wasn't. Really, it just said that the grid can't handle it, and I don't think that that's right. I think that's it seems like most of these electric vehicles also just naturally come being more energy efficient also.
That's true. Most of the gasoline or diesel that's burned turns into heat and doesn't move the vehicle. Electric vehicles, 100% of the power, runs the vehicle. So the equivalent is most electric powered cars are getting way more than 100 miles per gallon equivalent. They're just much more efficient and use much less energy than a fossil fuel powered car will do. Another interesting thing about the charging at night is that as we move to getting more of our power from things like wind, the wind blows in the middle of the night, and there's not a lot of stuff on that needs electricity in the middle of the night. Factories are shut down, people aren't at offices, everybody's asleep. And so plugging in vehicles at night is really good because it can essentially soak up all that power that's going to be being produced by more and more wind generators that are out there that would otherwise kind of just be wasted because we didn't have a place to put it. So it's a very efficient way to sort of help get more clean, renewable, non-polluting energy, electricity generation into our economy as well.
Yeah, I do think that wind is. I used to be a big fan of wind, but I've watched enough things now that I'm um, much more excited about solar, just because all the different they place a lot of the wind things in specific areas to get wind, and they're the same areas where birds tend to fly through, because they're like just areas
Yeah.
where wind flows. And so I think that the most environmentally friendly thing are is to use solar, and I'm really excited about that. But you make a great point because obviously it's a lot better than burning fossil fuels.
Yeah. So I think I mean we're running out of time, but I think that was kind of where I wanted to wind up. Air pollution is a threat here. Vehicles are a source of local air pollution. The health impacts are very disproportionate. I mean, more people are being disproportionately harmed more than they should be being harmed if they live in certain areas. And there's a lot of strategies out there for cars and buses and trucks to get them off of fossil fuels and off of air pollution. And like I said, there's Illinois funds, there's federal funds, and there's a lot of other sources out there too. And it's really important that things like equity need to be prioritized in this transition. Not only making like what I said about CTA, making sure that the areas that have the worst challenges with air pollution because of lung disease and air pollution, but also things like poverty, that's where this needs to be put in first so that people get the benefits from it first. And there's also a big argument to be made that that's where jobs should be being created too as we transition.
Well, I appreciate all your time here, all your knowledge. I am curious, what do you think is the next step for people? If someone is excited about an electric vehicle, someone wants to get one, someone is looking for a new vehicle right now, what is their next step?
That's a really good question. And we are kind of in the Wild West right now. New vehicles are starting to come out, and there are lots of different sources of information out there. I mean, you could start at things like looking up Consumer Reports magazine, like how do they rank cars? What do they think of electric cars? What to look for? What to be wary of? And I think those sorts of like shopping guides are going to become more helpful as people start to look at electric vehicles and start to learn more about what how they work, what to look out for, what to look for in a good deal. And like I said, it's used market is going to be huge for people. I mean, I've never bought a new car in my life, and my parents bought one new car in my entire life. So I know there's a lot of people that are looking to see like, well, what's going to be available 2 years from now too. Start reading from good quality sources. Look up government sources, Consumer Reports, other sources that you would trust for buying a gas powered vehicle.
Yeah, I also am curious what the next step is for the rebates. How does
Well, I
it
told
work?
you everything I know, which is that I know that the state is aiming to get a EV rebate program in place and active by July 1st. They have started putting together the rules and the mechanics for how that will work. That's not set in stone yet, so we don't know how this is going to be run exactly. But like I said, between now and July 1st, things are going to start to gel and details will start to come out. The Illinois EPA is going to be putting information on its website, so I would suggest people kind of watch what's going on there. But soon things are going to happen soon. I just don't have the details right now because they haven't been ironed out yet.
Yes. Well, thank you so much for all your information, all the great knowledge that you helped share with us. I am excited to see where um, where all these opportunities go, not just for people to get electric vehicles, but like you said so many times, for people to get all these economic benefits from these environmental solutions.
Right.
Think I think this is a really exciting time for the city of Chicago, for the state of Illinois, and I really encourage everyone watching. Um, First of all, thank you for watching and staying with us to the end here. I encourage you to get involved with our branch. As you can see, Brian has his information up on the screen, but actually, for our branch, you can see in the scrolling ticker that you can join and learn more about all the work that we are doing in our Environmental and Climate Justice Committee of the NAACP by going to veganpolitico.org slash CWB dash NAACP. Thank you again, Brian, and I'll let you have the last word.
Well, no, thanks, Ryan, for having me here, and I appreciate being able to talk about this. I mean, it is something that's happening very, very quickly, and we're making history every week, every month as we go forward. And again, it's towards a healthier world for everybody. Whether you live here or whether you live on the other side of the world, this is going to make the world a better, healthier place for everybody.
Well said. And with that, we'll sign off. Bye.
Okay, thanks. We're off.